Hey, good morning. Eric Amati with Family First Life Medicare, and welcome to your Wednesday morning training. Today's August the 17th, 2022, and I've got exciting news today. We are officially, Family First Life is officially going to be supporting Medicare Advantage for AEP. We got 4 really exciting carriers to support during that: Aetna, WellCare, United Healthcare, and Humana, and will be available in all states. We're also the new training for the FFM, the Federally Facilitated Marketplace, the Affordable Care Act, ACA healthcare plans. We will also be supporting those for all of our agents that want to get into that business for the November 1st enrollment for 2023. So just a lot of exciting news. We're going to do a training first. So you're going to see a couple things today. One, you're going to see a training that Zach Egan did with Neil McMinn. And we're going to go over, and I know we've covered some of this over the last few weeks, but we're going to cover, again, what original Medicare covers, what it doesn't cover, which is the key reason why people would need a Medicare supplement or a Medicare Advantage plan. And so pay really close attention to this training. And then before we get into that, I'm going to also go through on the website. We've made some changes to make it real easy for you guys to get your AHIP taken care of and to get your FFM certification taken care of so that you can access these new products. So I'm going to show you that first. We're going to do the training with Zach and Neil, and then we've got Ron Miller on to do some more training on the Family First Life supplemental. So stand by. Okay, so on the FFLMED.com website, the Family First Life Medicare website, we still have the Get Contracted button up here. If you have not filled this out yet, that's step 1, is basically to click on this, and then you'll come in here and fill out this request contracting form. And let us know who your agency is, your agency admin, the admin email address, and the commission level that you have. Because on the Medicare Supplement side and the Medicare Advantage side, all 140s and 145s are overriding their agents. And so we want to get them contracted first, and then we will put the agents, all of the agents where they belong in your proper organization. So at the bottom here, we've added the Medicare Supplement comp grid and the Medicare Advantage comp grid. And you guys can come here and kind of do the math on how it would look for you and your team if you wrote 100 apps during AAP, 1,000 apps during AAP. It's pretty cool math if you want to run a spreadsheet or geek out on the commissions. I did, certainly. So, and then on the front page here, right here, you've got 3 different links that we added to make it real easy for everybody. So number 1 is Medicare 101. So if you have a health license, and that's all you need to offer Medicare Supplement, you're ready to learn how to sell Medicare 101. And so inside this course, there's modules on everything from original Medicare, Medicare Advantage, Medicare Supplement. What are the parts of Medicare? What are the plans? How are these letters? What do they mean? All that kind of stuff. And it's all free, stuff that we've put together with other integrity partners, Elder Care, people like that, Senior Sales University, and so on. This middle link for AHIP certification. AHIP stands for American Health Insurance Plans. It's a class that's run by CMS, which is the Center for Medicare. And you have to pass AHIP, get AHIP certified before you can offer Medicare Advantage. So because everybody watching this video, I'm sure, has Aetna, is appointed with Aetna for final expense. And because of that, you're also appointed with Aetna for Medicare Supplement. It's a one and done type of a thing, all encompassing. Because of that partnership with Aetna, you can save $50 off of it costs $175 to take AHIP. If you go Google, you can find AHIP, pay $175 and get certified that way. Or you can use this link, which will take you to Aetna, and you'll sign in with your NPN and your password. And if you've never done AHIP before, you just create a new account here, and you'll save $50 off that price. So instead of $175, it'll be $125. Okay. And this is where you come for, that's what I recommend that you do for AHIP. Okay. And then if you want to offer the ACA marketplace plans, the Affordable Care Act marketplace, Obamacare, whatever you want to call it, through healthcare.gov, you need to get the federally facilitated marketplace certification handled. That's free. Okay. And so if you click here, it'll take you over to CMS. You'll click new user registration, and you'll sign up for it's right here, the FFM, Federally Facilitated Marketplace Request for MLMS Training Access. Just click right here and go through the steps. If you get confused, the how can I help you button, these guys are, the chat's standing by almost all the time. I was able to figure it out. If I can, all of you guys can too. This doesn't take very long. FFM, I would do that first if I were you. It'll take you a couple hours if you're doing it for the first time. AHIP, that could take you a couple of days. I mean, there's 5 modules. You need to pass with a 90%. So you'll want to absorb the material too, and you'll see on this next training that we do with Zach and Neil, when he gets into Medicare Advantage, you'll see there's a lot to learn there. And so, for those of you that really want to take Medicare seriously, get both of these certifications. Okay. If you are, not really wanting to divert into full-fledged Medicare during AEP, but you just kind of want to have Medicare in your back pocket, I would just get your health license and do Medicare Supplement, and maybe work out a commission split with one of the other agents or something like that for Medicare Advantage. Hey, I'll refer you one, you refer me one, that kind of thing. Just because a little less certification never hurt anybody. So hopefully that helps. Okay. And then on here, on the website too, you can dive into all these different modules and learn about all the different plans that we're making available through FFL Medicare, whether it's through the Cigna Supplemental that Ron's going to be covering later, or hospitalization plans, how they tie in with final expense, how to cross-sell, all that kind of stuff we built out a lot of information on here and a lot of training to help you guys get up and running. So hopefully that's helpful. Stay tuned next for Neil and Zach.
Hey guys, welcome to this first training. We call it the Medicare 101. I've got Neil McMinn on the call here today, and he's going to be explaining the basics of Medicare, what it is and how it works, to give us a better understanding of how we can service our clients. Neil, are you there?
Yep. How you doing, Zach?
I'm doing great, man. So how long have you been selling Medicare?
So I got my start in the industry with a practice company around 2003, so going on 20 years. So Zach, what we're going to do is just kind of a basic run through of what is Medicare. We'll jump into who is exactly eligible for Medicare. That way, whenever we're operating in our normal business capacity, we'll be able to properly identify what clients are targets for us to be able to serve and help take care of their Medicare needs. We'll talk about coverage options, where somebody can enroll, and then we'll go over next steps and then answer any questions as well that anyone might have. So first of all, who is eligible for Medicare? First of all, you have to be a U.S. citizen or a legal resident for at least 5 consecutive years, and that's a big important distinction, and one of the following: you have to be 65 or older. If you're under 65, you have to have a qualifying disability. And then also any person diagnosed with end-stage renal disease or Lou Gehrig's disease, otherwise known as ALS. So we put together kind of a just brief one-pager snapshot to help everybody in terms of reference. Instead of going through multiple pages of PowerPoint, you can save this to your phone, to your device, and then reference this really quickly. So this will be just for informational purposes and a quick reference, but for the rest of the presentation, we'll dive into greater detail. All right, so the different options that people have are Part A, which is hospital. Part B is going to be medical. Part C is going to be a combination of A, B, and D for prescriptions. Part D, Medicare Part D, is for prescriptions. And then you have Medicare Supplements, and we'll go into those as well. All right, so let's talk about Original Medicare. Original Medicare is Part A and Part B. Part A is going to be your hospital insurance. So when you think Part A, just think hospital and most everything associated with hospitals, such as inpatient hospital care, inpatient mental health care, skilled nursing services, hospice care, and then some blood transfusions. Not all blood is included. Also, the costs for Medicare, it's premium free. So unlike Part B, you're not having a premium deducted each month from your Social Security check, and you don't have any out-of-pocket expense when it comes to premium. As long as you've worked 40 quarters in the United States, there is a $1,556 deductible. Now that's for 2022. That'll typically change every year. So each year, typically with the cost of inflation or cost of living, that deductible is going to go up. So when 2023 plans become available, usually around June or July, we'll make sure to update this with the new numbers for 2023. Coverage, stays of more than 60 days in the hospital all have daily copays. Up until 60 days, there's no copay. You can utilize any hospital that accepts Medicare, and because Medicare is pretty much universal, pretty much every hospital accepts them. It's very rare to find a hospital that doesn't. Hospital coverage outside of the US usually is not covered. So that's an important thing to know. All right, original Medicare again with Part B, this is going to be your doctor's visits and outpatient visits. So primary care specialists, that sort of thing. So physician services, outpatient hospital services, ambulance, outpatient mental health, lab services, durable medical equipment, things like wheelchairs, oxygen tanks, even hospital beds for in-home use, outpatient physical, occupational, and also speech language therapy. And then some preventative care is also covered under Part B, things like vaccinations and things like that. Cancer screenings, different things like that. So in addition to that, under Part B, as far as your costs, you're going to pay 20% of the Medicare approved costs. So Medicare helps control pricing so that prices don't get too out of whack. And your cost share of whatever the approved cost is going to be 20%. Obviously, Medicare is going to cover the rest of that up to a certain amount. And then annual deductibles are going to be in 2022, $233. Now, your monthly premium is actually adjusted based on your income, and it might actually be higher if you sign up after your initial enrollment period. So either when you're initially eligible, if you wait, there could be a potential penalty, and we'll cover that as well. So coverage, again, is going to be physicians who accept Medicare, which most physicians do, and then also some preventative health care is provided. Okay. So what's not covered? This is an important thing to know because your clients will automatically have that question. Part A and Part B deductibles are not covered. Any co-insurances and any premiums are not covered by Medicare. That's going to be out of your client's pocket. Any Part B excess charges. So these are going to be charges above and beyond what Medicare has approved. And then any outpatient prescription drugs, also additional. Now, again, that's important to note there, outpatient prescription drugs. Additional benefits such as hearing, vision, and then most dental is not going to be covered by Medicare as well. Long-term care and also custodial care is not covered by Medicare. Part D is going to be your prescription drug plan. That helps with the cost of prescription drugs. It's only offered through private insurance companies, so you can't get Part D coverage through original Medicare. That has to come through the different companies that, and carriers that we represent. You have to continue to pay your Part B premiums as well. And then for medications you receive from a retail or mail order pharmacy, either or. All right, the cost, actually coverage varies from plan to plan, and all the plans are different depending upon your geography and the county that you live in. And plan premiums change and costs change every year. Catastrophic coverage protects you from the high costs of drugs, right? So as opposed to going broke, spending inordinate amounts of money on your prescriptions, there is a catastrophic coverage component of the plan. Benefits, like I said, do change from year to year. Now, as far as enrollment, coverage is not automatic. So unlike Part A, you do have to elect to enroll in Part D. And then same thing like Part B, if you enroll late after your initial eligibility period, penalties might be applied. As far as the coverage, each plan has a formulary or list of drugs that are covered. Each list can change throughout the year and usually changes from year to year, right? Now, within Part D, we have 5 different tiers, and that's how all of the prescriptions are, categorized. A formulary is the list of drugs that are covered by your Part D plan. All plans have this tiered formulary, so they're all in one of those 5 tiers as far as the different drugs. And usually the lower the tier, right? So tier 1, the lower the out-of-pocket cost. There's 4 different stages that we look at when it comes to Part D. So here's where it kind of gets a little complex. First of all, you have the annual deductible, right? Not all plans have annual deductible. And, that's typically either because they have a higher premium or they're provided to low cost or low income individuals. You have your initial coverage, which is going to cover up to $4,430. And then from there, you enter what's called the coverage gap, or what we call the donut hole. So picture a donut, and you've got one side of the donut on the initial coverage. You've got this hole in the middle, and on the other side, you have your catastrophic coverage. In the donut hole, you've got up to $7,050 that could potentially be a gap in coverage for you and a potential out-of-pocket expense for the client. And then after that, you have your catastrophic coverage, and that will cover throughout the end of the plan year. Coverage cycles start over again. Yep, go ahead, Zach.
So I guess this is the part maybe I need further explanation. So the initial coverage, it covers up to $4,430. So like if the person, can you give me an example? So like of what this means? Yeah,
so let's say I'm on 4 or 5 different drugs. I'm going to have my copays, right, for each drug, or I might have no copay. Right, the costs of those drugs accumulate up to $4,430, and then I enter the donut hole, right? And then at that point, I want to try and get through the donut hole as quickly as possible, because then I'm on the other side where the rest is going to be covered completely. Okay. Typically.
So the donut hole is that like $2,620.
Yeah, so it's actually going to be a total of up to $7,050 in potential out-of-pocket costs.
Got it. Okay. So after the 4430.
Correct.
Got it. Roger that. Okay.
Yep. So this is your coverage end over here, and this is your potential coverage liability of what could be out of your own pocket. And then you have the catastrophic coverage through the end of the plan year. Like I said, that's going to be, there to make sure that you don't have to pay anything more out of pocket. And then again, like I said, the cycle starts over January 1st of each year. Okay. But good questions. Right. So here we kind of go into the cost sharing. So annual deductible, up to $480. Not all plans have a deductible, like I mentioned. Remember, the initial coverage limit is $4,430. So in your donut hole, you're going to pay 25% of the cost of the covered drugs up to that limit, right? And then catastrophic coverage is going to jump in at $7,050 and above, right? So as soon as you hit this, think of, you may relate it to your personal health insurance plan. When you hit that out-of-pocket maximum, that's when your health insurance jumps in and pays the rest, okay? So then at that point, your drug copays are usually reduced to $3.95 or 5% of the drug, whichever is greater. And then your brands, non-generic, are going to be $9.58 or 5%, whichever is greater. So it's important, I'll make a note there. It's important to make sure that when you're, discussing a Part D plan, whether it is a standalone, what we call PDP, prescription drug plan, or drug plan incorporated with a Medicare Advantage plan, it's important to know all of the medications, whether generic or brand name, that your client is on, and then make sure to double check and reference the formulary relative to that plan to make sure that those drugs are covered, and then also make sure they're getting the best deal when it comes to not only the potential plan premium or deductible, but also what their out-of-pocket cost is relative to those drugs. It's also, you can really anticipate, there's a lot of different calculators out there. You can plug the drugs in and then anticipate, usually based on their dosage or on their frequency of the meds, at what point during the year they either will hit the donut hole and then come out of it, or if they even will hit it. Right. So that's part of the planning process that we provide, as Medicare advisors. So there's also what are called Medicare Advantage plans. Now, they do still incorporate, a common misconception is, well, if I'm on Medicare Advantage because it is provided by a private insurance company like Aetna, Humana, United Healthcare, that I don't have original Medicare anymore, right? And that is not true, right? So you still have original Medicare Part A and B. Part D is then included, right? And all of those together, plus additional coverage provided by the private insurance carrier, are what result in Part C, otherwise known as a Medicare Advantage plan. So like I said, it combines A and B, and then may or may not, depending on the plan you choose, include prescription drug coverage. They are offered, as I mentioned, by private insurance companies and include additional benefits above and beyond original Medicare, and that does vary by plan. Right, so the eligibility for Part C, you do have to be enrolled in Medicare Part A and B. You do have to live in the plan's service area. It is county-based, right? So the plan that I might have in my county, Zach, might not even be available in your county. And I might be telling you, oh, how great my plan is, and you might want my plan, or vice versa, but that might not be available because we live in different counties. In addition to that, you have to be able to make an informed decision, all right? And that's, again, why, we as advisors are so important. Now, as far as costs, when it comes to your Medicare Advantage, plan premiums and benefits change year to year, just like those Part D prescription plans. You do have to continue to pay your Part B premium. I will make a note that there are some Medicare Advantage plans that do offer to reimburse or return the Part B premium, but again, that varies year to year and plan to plan. So many plans do actually include the prescription drug coverage, and it can be limited to a service area unless it's an emergency, right? So that's another thing to consider. And again, if you're referencing your private healthcare plan that you may have an HMO or a PPO or a POS, point of service plan. Same kind of concept applies with your Medicare Advantage, where you may be limited to only doctors that are either in that network or that service area. Obviously, in the case of an emergency, that limitation is usually lifted. You may be required to use a network of doctors and hospitals and not have coverage outside of that, or your coverage outside of that could be much more expensive. And then it may include additional benefits above and beyond original Medicare, things like dental, vision, hearing, gym memberships are even included in some of these, and then different things like that. So the different types of Part C plans, Zach, the first thing you have what are called coordinated care plans. And you're probably familiar with this, these different terms, again, in reference to your private health plan. You have HMOs, right, which are health maintenance organizations. And then you have health maintenance organizations, POS plans, or point of service plans. Then you also have your preferred provider organizations, which are going to be your PPOs. And then you have SNPs, which are special needs plans as well. The other plans that are available are PFFSs, or private fee for service. You have MSAs, Medicare savings accounts, and then Medicare cost plans as well. So that's going to be your Medicare Advantage, right? Again, which is Part A, B, and C combined, D combined to form Part C. Zach, you had a question?
Yes, I did. So these Medicare Advantage, is there more availability? Like, where is there more availability? So I think I remember hearing there's more Medicare Advantage availability in more urban areas and maybe not so many plans available in more rural areas. Is that what you found?
Yeah. So, and you'll see, where that kind of comes into play when we talk about the Medicare supplements, but that's a great question. And if you think about it, when you have a more urban area, you have a higher population density. When you have a higher population density, you have more hospitals, more doctors, right? More Medicare or medical service providers. As opposed to a rural area, you might have one hospital, you might have a couple specialists, right? But otherwise, you might have to travel to a more urban area, to have access to different care. So that's absolutely true.
Got it. And then I guess the other thing with these Medicare Advantages, do you just choose one primary care physician and then, or one network, and then have to get a referral to go to other doctors?
Yep, another good question. Absolutely. So typically you're going to choose a primary care physician. If you don't already have one, The plan will select one for you based on your geography, and then you can change that if necessary. And then, yes, in most cases, again, depending on the type of plan you have, you're either limited to a network, or you do have, in the case of a PPO, you have a better, you do have coverage outside of the network, but you are going to pay a lot less in terms of out-of-pocket expenses if you maintain or your services within the PPO.
Got it. Okay. Thank you.
Yeah, great questions. So then we jump into Medicare supplement insurance. Okay. So think about this with your Medicare supplements, instead of combining everything together, right? So A, B, and then Part D for drugs. What I'm going to do is I'm going to stay just on Part A and B. I'm going to continue to pay my Part B premium. And then I may or may not choose to purchase a standalone prescription drug plan. But now what I have is I'm exposed to the out-of-pocket expenses that are not covered by Medicare. If you recall on the previous slide, we said here are all the things that are not covered, right? Your deductibles for Part A and B, your co-insurances, and then your excess charges, and then potentially, foreign travel emergency. All of those things not covered by Medicare is where your Medicare supplement steps in. Now, it can get a little confusing, but in general, we have plans A through N. And the difference between all of them is going to be what they do or don't cover, right? So I'm going to sit down with my client, and based on what they need, I can look at different plans and say, well, since you don't really travel outside of the country much, you probably don't need foreign travel emergency. And because you're pretty young and healthy, it may make sense to only do a plan that has just a couple co-pays, but your premium is super low. Or if somebody's very, very unhealthy and they go to the doctor a lot and they might be exposed to a lot of out-of-pocket costs, I might look at a plan G that's going to give them more comprehensive coverage, right? So again, it helps coverage. It's otherwise called a Medigap policy. It covers the gaps in original Medicare. It is like your Advantage plans sold by private insurance companies. You have all the different alphabet soup of plans here. You also have what's called a high deductible plan F and high deductible plan G. It is important to note that anybody new on Medicare as of, I believe, January or before January of 2020 is no longer eligible for plan F. So basically anybody that turned 65 after January of 2020 is no longer eligible for plan F. Anybody that was 65 prior to that can still get a plan F or a high deductible plan F. But basically the gist of a high deductible plan is you're going to say, you know what, I really want this comprehensive coverage, right? Because plan F and plan G cover the most. However, I'm still healthy now, but I know maybe later on in life, due to family history and other things, I may develop some serious things. So I want to go ahead and lock in my premium now and get it while it's low. And then if something were to happen to me, I'm going to have a high deductible where that comes out of my pocket. But then once that deductible is met, the coverage jumps in and covers pretty much everything else. Okay. So again, a lot of this is modeled after, your traditional health insurance plans that most of us are used to. Massachusetts, Minnesota, and Wisconsin are all, they have different standardized plans. So it is important to note that no matter what company or what state you're looking at any of these plans in, except for these three, Massachusetts, Minnesota, and Wisconsin, they're all standardized. And what that means, they're all the same. So Zach, let's say you're United Healthcare and I'm Humana. When we sit down together and we offer a plan, let's say G to our clients, the only difference in the plan is the company that's offering it and then potentially the premium, right? So your premium might be lower than mine, but we're both selling the same Honda Accord, if that makes sense. Okay. And then as far as eligibility goes, you must be enrolled in Part A and B to have a Medicare supplement. You do have to reside in the state in which you are applying for coverage. So that's important for, states where snowbirds come, Arizona, Florida, those different states. And then also 65 or older, or if you're under 65, that's available in certain states as well. As far as the costs when it comes to Medicare supplements, it helps with some of the out-of-pocket costs that are not paid by original Medicare. Premiums do vary based on age, sex, tobacco status, so smoker or non-smoker, your zip code, and then the plan selected, and then obviously the carrier or the insurance company providing it. but otherwise all of the benefits within the plan are the same. Enrollment is pretty easy. The best time to enroll typically is the 6-month, what we call OEP, open enrollment period, following your 65th birthday. So following that month, and then, or your Part B effective date, right? If that's later. Now, why that might be later, Zach, is let's just say, for example, you turned 65, but you're still working, right? And you like your employer sponsored plan, right? Part A is going to be automatic. So as soon as you become eligible for Medicare and turn 65, you're just going to automatically have Part A. But you don't want to enroll in Part B because you have that great health insurance that you like through your employer. Now, let's say you're 70 years old and you're like, all right, I'm ready to retire. Now, when you retire, you're going to have that same open enrollment period for your Part B effective date. And that will obviously be that later time. And that's when you can apply for your Medicare supplement. Does that make sense? All right. And then there's other situations where acceptance may be guaranteed. So that's going to be relative to health, where you worked and other things like that. Also, there's different opportunities, and we'll get into this in a later training because this is, again, your 101. But there's opportunities based on what your experience is with your Medicare Advantage plan where you might have the opportunity to have a guaranteed eligibility or enrollment in your Medicare supplement. Okay, so there's different plan choices. Here's a nice little visual to take a look at. All right, so step one, you have to enroll in original Medicare, right? So Part A, automatic. Part B, that's going to be, you're going to enroll in that. You've got a premium for your Part B, right, that you pay each month, typically out of your Social Security check. Now, step two for the client is to decide if they need additional coverage and then decide which way to get it. One of two ways. Option one, add one or both of the following to original Medicare, which is going to be a Medicare supplement, what we just went over, right, to cover the gaps that Medicare doesn't cover, and then Part D for prescriptions. That's option one. Option two is going to be Part C, Medicare Advantage, right? And Part C is going to combine Part A and B along with Part D drug coverage, okay? So when can your clients enroll, right? So the IEP, or initial eligibility period, is the month you turn 65, and then you have your 3 months before and then your 3 months after. Right. So I have, if it's, June, that's my birth month. I've got from March, April, and May, the 3 months before that, I have my birth month, and then I have my 3 months after. Make sense? All right. So what if I work, again, we just use this analogy with you, Zach, let's say you work past age 65, you may enroll in Parts A and B. It's recommended that you do speak with your benefits administrator at, your employer. You do have to keep records of your health insurance coverage, and then enrollment after age 65. So when you're retiring, you may be eligible for what's called an SEP, Special Enrollment Period. And what that does, that allows you to enroll in original Medicare for up to 8 months after the loss of what's called credible coverage or employer coverage, whichever happens first, right? And then what's going to happen is you enroll in a Medicare Advantage plan or prescription drug plan for up to 2 months after the loss of your employer benefits. So it's important to understand and know those windows. And obviously we'll have cheat sheets for everybody, but with most of the carriers and the Medicare platform that we're working with ElderCare, there's a lot of support there to make sure you're always doing the right thing. So if you're brand new to Medicare and you're working beyond 65 in a employer that has fewer than 20 employees, you have the same, open or eligibility period, right? So your 65th birthday with the 3 months before and after, right? You have your Medicare supplement open enrollment, right? Your eligibility begins the month you turn 65, right? So remember, back here we were talking about Medicare Advantage and Part D prescriptions. And then here we were talking about my eligibility working beyond 65 with fewer than 20 employees, right? So I'm coming off of a group health plan. And then my eligibility when it comes to a Medicare supplement, I have my eligibility beginning in my birth month, and then I've got my 6-month window, right? So the period lasts for 6 months and begins on the first day of the month, which you're both 65 or older and enrolled in Medicare Part B. Go ahead, Zach.
Is this just guaranteed enrollment period? Because can't you always enroll though?
Yeah,
or
so
try to enroll?
correct.
Sorry.
Yeah, so think of it as, again, any experience you have with your group employer plans, this is kind of the same concept, right? So this is going to give you that guaranteed acceptance period, regardless of your health, regardless of anything. Your Medicare supplement companies have to take you. If you're outside of this eligibility period, unless you have an SEP, special election period, relative to a specific disease or certain situation, you can then be declined, right? So you can apply for a Medicare supplement outside of this, and they can say, sorry, we took you through underwriting, we just can't accept you, right? So yeah, that's an important distinction. Now, one of the things we'll note in a later training is how to identify prospecting opportunities relative to people that are turning 65 and then different enrollment scenarios. So additional elections, you have your AEP, right, which most people are familiar with. That's your annual enrollment period. That's October 15th through December 7th. And then that's for plans beginning the following year. So Zach, this coming October 15th through December 7th, when we're enrolling new customers, it's for their 2023 plans that will begin on January 1st. All right, you have open enrollment, and that's January 1st through March 31st. And that gives the client an opportunity to change from one Medicare Advantage plan to another, or back to original Medicare, either with or without Part D coverage, right? So maybe they made a mistake, they found out their doctor wasn't going to take that coverage, they moved, whatever, gives them the opportunity to be flexible and not locked in to that plan. They also have SEP, special enrollment periods, and those examples include moving into a new service area, right? Discontinuation of your current plan. So sometimes plans just, they just close, right? So they don't offer that plan anymore. And if that plan's not offered, then I can have a SEP. Also receiving skilled nursing care, and then also low income and Medicaid clients are SEP eligible. All right, so the next steps with our clients, what we want to do is review the enrollment periods. I think it's really important to become very fluent and familiar with your enrollment periods. So that way, when you sit down with a client, you can speak very fluently and the proper steps and plan eligibility and availability for that client. So definitely review that. The client does have to research their options. So that's one of the things we provide as brokers. Asking questions and seeking help, and then we just enroll. And then each year, and this is what's great for us, is each year our clients can come back to us and re-enroll either in the same plan or a different plan. Okay.
Hello, everyone, and welcome to another episode of Family First Life Supplemental. My name is Ron Miller, and I want to welcome Mr. Jason Easley with FFL Marathon.
Thank you for having me, Ron.
So, Jason, tell us a little bit about when you started with Family First Life, a little bit about your background.
I started with Family First Life in February, come down to the convention. My background, I've been in the insurance industry since 2014. Basically just did supplemental policies, had a little bit of life insurance policies to go along with it. If I had somebody ask me about it, I would always tell them to look for somebody else or refer them over to a friend on the life side of it. So now, it's kind of come full circle to be back in the supplemental and have that opportunity with Cigna.
Man, I think you and I come from sort of like the same boat. So I came from a former company myself, and the same thing. We were selling supplemental left and right, but we had one life insurance policy where if you didn't fit into that basket with the requirements, you're pretty much out. And when I came over to Family First Life, this has been about over 2 years now. The fact is, we are protecting individuals, but supplemental has always been on my mind, just for the fact that when I think about supplemental, it is a true living benefit. And I love the fact that Family First Life has the ability to go out there and protect individuals or their families when someone passes away. But what happens when somebody goes through cancer, heart attack, stroke, or a major accident, right? These true living benefits is a blessing, which I see to everyone. And I've said this before, unless you have a crystal ball that can predict your future, it's always better to have than not have. And so when I came over here, thank you, Mr. Sean Mike, and thank you, Integrity, for bringing it on board with us. It has now come full circle where we are now considered a one-stop shop. And correct me if I'm wrong, but this ability that we have today lets us encompass the life insurance aspect and bring in the supplemental into one, because they tie hand in hand, right? So for the most part, when someone goes through something major like cancer, for example, one of the worst diseases out there, a lot of times when people are going through that, they're trying to fight this. They're trying to, go through chemo radiation to get rid of this cancer. But for the most part, they stop working. And that has been something that's huge, because as we both know, when an individual doesn't work, they can't pay for, they're not making money, so they can't pay for their house, they can't pay for the food, utilities, let alone, the life insurance policy that we're trying to sell where they may already have. So tell us a little bit about, for you, what has Supplemental done for your clients? And I know you and I talked a little bit about what Supplemental has done for you. If you can talk a little bit about that, but for the most part, give us a background as far as over the years, some of the things that the clients have talked to you about, why it's so important.
So the important part about it is just like you were talking right there, loss of income, food, lodging, transportation. You're out of work. Where's the income come from? And these supplemental policies tie straight in. Back to what you were just saying, without that income, you can't really cover the life insurance premium every year. But supplemental, being in that industry, you kind of just get set on what it really does for people. I think we all know somebody that's battled cancer, had a heart attack or a stroke, and to have something to help them while they're living and out of work, whether it be the lodging side of it, or getting the treatment they need. So many people, that's one of the leading causes of bankruptcy in America today is families losing income and serious illnesses. But to have the supplemental, it ties in the chance of a person going through it. 1 in 3 women, 1 in 2 men have a lifetime risk of battling a cancer situation. So it's a pretty good thing to have a lump sum policy like we have now.
And then you were talking to me a little bit about yourself. So you went through an episode where a supplemental policy actually benefited you and your family. Tell us a little bit about that.
So when I started with the company, I'm one of those, just the same as we were talking earlier about, any policy you have, you want to speak to an individual and you want to carry that policy for your family. So I'd started off, I guess, probably 7 years ago and had a heart and stroke cancer policy and an ICU of $900 a day on my family. I have 4 children, so it's one of those things. It's a pretty neat little thing. But probably in 2017, I was in the backyard with my children on Super Bowl Sunday and had a gas can explode on me. And I was burned 52% of my body, airlifted up to a Baptist Medical Hospital, spent 32 days in ICU. Unfortunately, I had a policy that paid $900 a day in ICU. It had a max of 30 days per occurrence you have on it. But just to get that $27,000 check while I was, recovering there in the hospital, family was taken care of while I was getting back to work.
So as you know, and I've said this before also, where life is weird, it throws those curveballs when you least expect it, right? And for any individual that's listening to this episode, life can be weird, where things that happen unexpectedly, it's something that in the back of my mind could happen to my family, come to myself. And that's why I always try to look at what's out there, and I try to get protected as much as possible. Unless you have a crystal ball, and I've said this before, which we all don't, you can never tell what's going to happen, right? Just like with you. So over the years that I've worked in the supplemental side, just like you, Jason, I've been a blessing to a lot of individuals out there, and I get calls almost weekly to this day regarding things that happen from, cancer, a major heart attack, a major accident, people in ICU, people in hospitals, right? And that's something that never stops. It's something that seems to continue day after day after day. We're in a position with Cigna, right? And this is something that's come to fruition where now it's such a blessing that we're offering to individuals. But what I like about Cigna is the fact that there is a lump sum, and the lump sum can pay anybody from the heart attack or stroke or cancer from $5,000 up to $75,000. And I've done this long enough to tell you that when someone gets diagnosed, say with cancer, for the most part they're not going to be working because they're trying to go through chemo radiation to fight this. A lump sum of 10, 15, 20, 30,000, it's sort of like an ease of your mind, knowing that you're not going to worry about having to pay that mortgage for the next couple of months, right? Or the rent, or you're not going to worry about putting food on the table for your kids. You can go forward and you can go out there and try to beat this thing. And as you know, with stress is one of those contributors to cancer, and it can actually cause it to be even worse. With Cigna, there's so many different aspects of these policies, which is crazy. For the cancer alone and the heart attack and stroke, I mean, you can add on a benefit rider, which allows you to, for that individual, every year that they have the policy that's not used, it can go up another $500 a year or
That's nice.
$1,000. So if I bought the policy today and for 5 years, hopefully I never use this, but let's say 5 years from now, I had the benefit rider that built up $1,000 a year, and I started with 20,000. In 5 years, it'd be worth $25,000 lump sum.
That's a nice booster.
And then as far as a reoccurrence benefit, you know, with Cigna, if you have that policy in place and let's say you beat the cancer or you had a heart attack or stroke and you're fine now, right? Let's say it happens again 2 to 5 years later. You'll get 25% of that lump sum, which again, it's going to be a blessing.
That's
If it's
nice.
and if it's 5 to 10 years, you'll get 75%. If it's over 10 or 5 to 10 years, it's 75%, and over 10 years, it's 100% of the lump sum all over again. It's 100%. So that alone gives it the individual that peace of mind, knowing, God forbid it does happen, and you and I both know this, it happens quite a bit. Cancers do come back. Heart attack and strokes, it can pop back up, right?
That's correct.
And the fact, just like you just talked about, when you had the ICU and you're able to get $900 a day every day that you were in there when you went through the burns, and I feel you, because my younger brother went through something similar himself, and he got burned over 75% of his body from an accident in the backyard when my dad was cooking out. But you know, the ICU, we can go up to $1,000 a day with Cigna, which is awesome, right?
And you know, Ron, I mean, if you have a heart attack or a stroke, pretty good chance you're going to be in ICU as well. So, you know, that's a nice little additive to that as well.
Yeah, and then you can also have a hospital indemnity. So if you're in the hospital for any reason, it can pay from $100 all the way to $1,000 a day as well. It's up to you or the client what they want to get.
And you can tell that in to anyone that's having a child. You know, they're going to be in the hospital having a baby. So that's a pretty neat little thing to add on.
Absolutely. And as you know, when someone goes into the hospital, it's expensive. ICU, it's a step above that. I mean, heck, they charge you for a cup of ice, which they call rock chips or whatever, you know, ice chips, and it's through the roof.
It is.
And as I see with healthcare rising to this day, individuals are leaning more and more towards the supplemental, which is, again, it's going to be a blessing, because I see people that they're having their health insurance, they're paying a $10,000 deductible, right, for something major like a cancer, or heart attack, or stroke, right?
Yeah.
So this comes in very nicely, and it ties straight into their health insurance. And as I look at it, everyone that's out there should have a policy set in place one way or another, because again, unless you have a crystal ball, which we don't, you never know what the future is going to hold. Tell us a little bit about Jason, as far as the opportunity with FFL. We have the highest commissions on the life insurance side. Tell me a little bit about the company that you run. Tell me what did you start with at your other company, and what was your ending commissions when you left?
So there was a group of us. We were constantly the top producers for the years I was there. Our comps never changed. We never had an avenue to grow any higher. We started at 35% comps and stayed at 35% comps for the whole time I was there. You know, the great thing about it, you know, we were writing $35 cancer policies and still doing 15,000 AP a week. You know, to have the comps with Cigna, you know, you're starting out at 70% comps. That's a game changer. Even to have the lump sum, we had policies, you know, that had no lifetime maximum on them, but they just, you know, you go to put a claim in on it, and when you put a claim in, you got to get an itemized bill. You know, you may get one from the anesthesiologist, you may get a surgery bill from a surgeon. That lump sum thing's a game changer. You know, I've had a lot of clients, you know, and I'll share a story real quick about a client I had. It's probably been about 2 weeks ago. You know, everything I do is all about family. and she had a daughter that was 18 years old on her heart stroke policy. And unfortunately, the little girl was in college, had 3 strokes. To have her on that policy, that's a lot of, just thinking as a family, that a kid could actually go through something like that. But I look back and I think I could have helped them a lot more by having them on a lump sum policy rather than having, a $1,500 payout plus a surgery bill and all the, food, lodging, transportation. To have, something like a $25,000 check come out would have been a lot better of a policy.
Yeah, any which way you look at it, for myself, something's going to be better than nothing. But absolutely, I've worked in the supplemental business over the years, and when you have something that's going to be paying out over time, just like your cancer policies that are out there, these are what I call treatment policies, right? And for cancer, it can be long lasting. It could be a year, it could be 2 years, it could be 5 years. Right. But the fact is that lump sum does tie in very nicely with the peace of mind, knowing that you have something up front that you can take the time off from work that you need to get better, right? But even with Cigna, we, talking about the treatment policies that they have, it's one of the best out there, and you can build it any which way you want to. We are here to provide and help, and what I like about this whole thing is we're helping protect that client.
No, 100%.
And there's a lot of people that will talk to you that maybe be stretching their cash flow, but at the same time, we can get them into something, right? It could be a $20, $30 policy, but again, something's going to be better than nothing. And the fact is, over the years, I've done this just like you have, where you do have to turn in a claim form, you do have to go get an itemized medical billing, you do have to get the doctor's signature.
All that becomes a job.
Yeah, it's a job.
It's a job.
And it could be time consuming.
Yeah.
But being able to offer that up front, again, it's a game changer. It's exactly what you said. It's a major game changer that just keeps getting better. And at the same time, all those different riders that go with it also can be a blessing, because as you know, with cancer, I mean, if you're in the hospital every single day, even though your health insurance can kick in and pay for a lot of this, it won't pay the entire bill. And this is money that's going directly to you, and it's tax free. So again, for Cigna, this is one of the best things out there. And when you're talking about the commission aspect, we're in a place now where, as a one-stop shop, we have the highest commissions on the life insurance side. Now we have the highest commissions when it comes to the supplemental side. And when I look at this, and individuals like yourself and myself, Jason, are coming into FFL, why would you work anywhere else?
100%. I agree.
And for a lot of individuals that are out there maybe listening to this that are not with us, it's like you're doing the same amount of work where you're at today. Over here you can get paid twice as much, or even more than twice as much. It's like, when I look at what we're doing, yes, we are protecting the families, and that is something that I always say: let God lead you into that direction and have a servant heart. But we're also trying to build our legacy, right? We're trying to help our own family, and that's what I love about Family First Life. Sean Mike always puts it out there that we're here to help others, right? He's in a position to help us, and that's why we're moving forward with Cigna, and that's why we're constantly improving when it comes to Family First Life altogether. So I
can tell you, seeing the families and the tears, and when you have a family battle of cancer situation, and the hugs you get, and the gratitude of having that policy, I can't. I mean, I come from writing 700 policies a year. You're gonna have a lot of occurrences going with that. It's kind of the same gratitude you get when you going up to hand a check to a family, with the loss of a loved one. But this right here, just the supplemental side it's a big thing.
And it's something that is going to be neat. I mean, unless they cure cancer, which I hope someday they will, or they can find something to cure, prevent a heart attack or stroke. These are things that it's set up to help an individual in case something does happen. And I've seen it over the years where, us as individuals with sell or protect families with this insurance that we do, like, no one wants to buy extra insurance. We have insurance for our house, our cars, our phones, even, for our little gadgets that we buy. Why don't we have, insurance for ourselves and our families? And at the same time, when someone may complain about, oh my God, here's another insurance that we have to go and purchase. The fact is that insurance alone, we're the last ones they want to buy insurance from, just because there's so much insurance out there, but we're the first ones that they'll call when something happens. And for me, and just like you've had, Jason, over the years, I get those calls that say, Mr. Miller, or probably say Mr. Easley, thank you so much if it wasn't for you. And that always resonates in my mind, because people like you and myself and people that are out there to truly protect individuals, we are what I call angels, and it never stops.
Yeah. Yeah. And it's one of those things, Ron, you sit down face to face with people, and, you go through the family history on the heart disease, heart attacks. Cancer is just one of those things that doesn't care. When it strikes, we're going to all need some money, and we're going to need it fast. And that's what these policies right here do.
And exactly, I mean, hands down, exactly. Let's talk about now, Jason, a little bit about you've come in February, you're starting to sell Cigna. And I think it's law of attraction, because you're truly a man with a big heart. And I see there's a lot of agents that are following you, that are coming to work with you here with Family First Life. When we talked a little bit about the comp side for the agent, tell me a little bit more about what you see as a benefit towards agents that are coming to work with yourself or with Family First Life altogether.
The benefit, even on the supplemental side, though, is the renewal side. You're not getting the big comps like you may get the 130, 145%, but the comps that just kind of tells in with a life insurance policy to get them through, while they're living. But at 70% comps, it's just, man, it's unbelievable. I look back at all the years I sit there and I would write the 15,000 AP just to come home with, $3,500 check. And, I felt good. I just knew I didn't know anything different. So for the people out there that's coming along and to learn, these comps are, going to get you out of the gate fast. And back to the whole cancer thing, Ron, I mean, you could sit with a lot of people, and I can about bet that a lot of people have a cancer policy. And I always said, it's one of the craziest things to do, to wake up in the morning and say, hey, I'm gonna go out and sell a cancer policy. Honestly, it's not that big of a deal to sell a cancer policy. The people, that's been touched by somebody battling it, but now to be that agent and be a part of, somebody's family, and it's like no other when you're sitting in front of somebody and you sharing the story and their life, and it's just like life insurance, but you're helping them along the way.
Absolutely. Another thing that I wanted to point out, Jason, is that, as I've talked about before, this is like, we're just scratching the surface when it comes to supplemental now with Family First Life. But one of the benefits I see also with FFL is that now we can actually go after businesses. And I right. say this because we're helping more people at one time. There's so many different ways for us to go out there and protect individuals with life insurance, but the business aspect with supplemental is huge, for the fact that there are so many companies that are out there that maybe they're not in a position where they can afford to help that employee with these benefits. Us as agents have the ability now to go in and talk to these business owners and see what we can do to bring that to fruition. Because let's face it, some of these mom and pop companies that are out there, or some of the smaller ones, all their employees, if they're small, it's sort of like a family, right?
Right.
And why not be in a position to offer that family some extra protection? And I assure you, everybody that's out there knows somebody that's gone through cancer, heart attack, or stroke. We're in a society now where GoFundMe seems to be the norm. And for the most part, when I look at GoFundMe, it's like a lot of these individuals that really didn't know about the supplemental side. So for us to be able to do that and offer that is huge.
That's an avenue to open the door for everything. You get into a small business, most of them have group benefits, and to put that in their hands, it's only going to lead to an avenue to lead to life insurance. So, instead of, just sitting there dialing all the time, I think it opens another door where you can just stop by a small business and, pop in just like a phone call. All they got to do is say no, you go to the next,